My name is Anne Flynn, and I'm an assistant professor of medicine at University of Utah Health, and I specialize in inflammatory bowel disease. We'll be talking today about managing the cost of IBD medications and treatments for young adults. Thank you to the Crohn's and Colitis Foundation for the chance to give this talk. IBD is an expensive disease with many direct costs of care, things like clinic visits, radiology studies, procedures, and expensive medications. There are also indirect costs, things like disability due to active disease and missed work or school. Our goal here is to provide an overview of available programs and opportunities to help young adults manage the costs of IBD care. In May 2019, the Crohn's and Colitis Foundation published the results of a study looking at the costs of inflammatory bowel disease in more than 52,000 patients. The costs of care for an IBD patient were looked at and compared to the cost of health care for a patient without IBD. They looked at the costs paid by the health plan and also the cost to a patient, things like deductibles, copays, coinsurance, and the combined total cost. The study found that the costs of care for IBD patients are more than 3 times higher than the costs for a non-IBD patient. IBD patients have more than twice the out-of-pocket cost compared to a patient without IBD. And this estimate doesn't even include the amount that IBD patients pay for insurance premiums or other indirect costs, things like lost wages, time for caregivers, childcare, or transportation for their health care. So this likely significantly underestimates a patient's out-of-pocket cost. These costs have increased in the past 5 years, driven in part by the high cost of medications. The youngest and oldest patients with IBD have the overall highest cost burden. There's an immediate need that we identify cost-effective strategies to reduce the cost burden on patients and families affected by IBD. In today's webinar, we're going to be covering 5 main strategies for lowering your IBD costs. First, we'll look at factors to consider when you're choosing a quality health insurance plan that meets your needs. When you turn 26, you're no longer covered under your parents' health insurance. It's very important to start thinking about a health plan that meets your health needs before your 26th birthday. Next, we'll examine how to maximize your health insurance savings by using money in health savings accounts toward your out-of-pocket expenses. We'll talk about manufacturer assistance programs, which are funds from the manufacturer that help patients pay for their out-of-pocket costs. We'll share resources for some grants, foundations, and other assistance programs that offer additional opportunities to apply for financial assistance, and we'll provide a general overview of disability programs, what they are, who's eligible, and how to apply. Public and private health insurance programs will help you to pay your out-of-pocket costs. Once you turn 26, you're no longer eligible to remain on your parents' health insurance. So it's important to start thinking early about your IBD needs and begin considering what is needed in a health insurance plan. You will need to enroll in health insurance. This can be through a plan sponsored by your employer or your spouse's employer. You can also purchase a plan through the health insurance marketplace or through a private company. If you're disabled, you may be eligible to continue coverage under your parents' plan beyond the age of 26, but that's a very special circumstance. If you choose to enroll in the health insurance marketplace, the special enrollment period starts 60 days before you turn 26 and ends 60 days after your birthday. So it's important to complete enrollment in advance, and then the new insurance can take over as soon as you turn 26. There are options to purchase insurance on your own, but this can be very expensive. There are also temporary options, like continuing coverage through your parents' plan on COBRA, but this only lasts about 18 months. Depending on your income, you may be eligible for enrollment in Medicaid. Regardless of the plan you choose, it's important to consider your individual healthcare needs when shopping for insurance. Here are a couple of tips to think about when evaluating insurance plans. First, be sure that you pay attention to the out-of-pocket deductible, not just your plan's monthly premium or the amount that you pay each month. Plans with lower monthly premiums often offer you less coverage, so your overall out-of-pocket expenses may be higher. Look at the out-of-pocket maximum and evaluate how much you're required to pay as a deductible before your plan covers your healthcare visits or medications. Be aware that some plans have different deductibles for medical and pharmacy plans. So in some cases, the copay that you pay for clinic visits or procedures may not be applied to the deductible for medicine coverage. Also be aware of any plan with coinsurance. With coinsurance, a certain percentage of drug costs must be paid by the patient. This can be 5% or up to 25%, but with expensive IBD therapies, this can add up to thousands of dollars per month. If you see the word coinsurance, look into the plan further. Understand what your costs will be if you need to have a major medical procedure or a surgery. How does your plan cover an unexpected hospitalization or an ER visit? How much will be covered and how much will you be expected to pay? Evaluate whether your plan will allow you to remain on the medication that you're taking. Sometimes when you change your health plan, your medication may not be covered and we need to appeal for coverage of your current therapy. This can take time and can cause delays in you receiving the medications that you need. If you want to stay with your current healthcare team, check to be sure that your providers are covered on your new plan. Ask your current provider about their experience with any plan that you're considering. They may be able to give you feedback about working with a particular insurer. Contact your doctor's office right away when you have a change in insurance. Often your medications will need to be reauthorized, and the sooner that your provider is aware of insurance changes, the sooner that they can help to be sure that there's no disruption in your treatment. This can be a very stressful time, and we do our best to support you through this process. If for any reason there's a lapse in your insurance coverage, your doctor's office may be able to provide medication samples to be sure that you don't go without your medication. There are also manufacturer assistance programs that can help give you coverage for your medications until you're insured again. The Crohn's and Colitis Foundation has developed an IBD insurance checklist to help you keep track of all of this information when you're evaluating insurance plans. If you have the option of participating in a health savings or flexible spending account, take advantage of these programs to help you pay for out-of-pocket costs. If you have private insurance through your employer or purchased on your own, you may be entitled to participate in savings accounts to help with out-of-pocket or uncovered expenses. You can contribute a certain amount of money each year untaxed. This money can then be used toward out-of-pocket expenses like deductibles, co-payments, and co-insurance. Health savings accounts are available when you choose a high-deductible health plan. One good feature of these plans is that you can typically roll over your unused balance into the next calendar year. One disadvantage is that with a high-deductible health plan, you often need to pay most of your health care costs on your own, either through the health savings account or out of pocket, before the insurance company starts to provide payment. So this can often result in very high out-of-pocket costs. If you're purchasing a plan on the healthcare marketplace, you can check to see if they're HSA eligible. Flexible spending accounts are an optional choice through other standard insurance plans. You can set aside a portion of your salary, which is not subject to payroll tax, and this money can be used to pay for qualified medical expenses. Sometimes you receive a debit card, or you can pay on your own and then claim those expenses afterward with a qualifying receipt. Some programs allow you to carry $500 into the next program year, but other times it's a use it or lose it with those funds, so you want to make sure that you fully understand individual program requirements. Next, we'll look at program assistance opportunities. With drug copay programs, the manufacturer pays a portion of the drug cost to lower your out-of-pocket cost. These programs are only available if you have private commercial insurance. The Crohn's and Colitis Foundation has a searchable database of copay programs for IBD medications. You can also search on needymeds.org or ask your provider or pharmacist whether a copay card exists for your medication. Beware if your program includes something called a copay accumulator program. This means that funds from the manufacturer do not count toward your deductible or your out-of-pocket maximum. In this case, the manufacturer funds prescriptions, and at some point, the maximum value of the copay program is reached. Then the patient begins out-of-pocket payments, and only then do payments begin counting toward their annual deductible and out-of-pocket maximum. So you may exhaust the copay card fund and then be left with very high out-of-pocket costs. Any high deductible plan that does not allow copay cards to be used toward accumulators is a problem. If you're having trouble paying for the cost of your medications or other aspects of your IBD care, always discuss this with your IBD treatment team. I often meet with patients who are not aware of these programs or who stopped medications or clinic follow-up due to inability to afford these costs, and we can help you with this. Pharmaceutical patient assistance programs are separate foundations set up by the drug manufacturers to provide financial assistance to people who cannot afford their medications. This is different from copay assistance. You need to demonstrate financial hardship or financial need when you apply for these programs. You can find out about these programs on manufacturer websites, needymeds.org, or at the Crohn's and Colitis Foundation website. Laboratories or testing companies may also provide financial assistance if a lab test is denied. If you're concerned about the cost of a drug level, or if you've had a high cost with a lab test in the past, be sure to bring this up with your doctor. Some companies have an out-of-pocket cost cap, for example, on biologic drug levels, or a maximum patient responsibility if the test is not covered in full by insurance. If you know that a specific lab test was not covered in the past, talk to your team before those labs are drawn. Your physician may be able to direct you to a lab that's covered by your insurance or that's more affordable. Your provider may be able to talk with you about an alternate plan that's more affordable for you, or your provider could help you appeal to your insurance if needed. You may be able to apply for assistance through the lab testing facility. It's also possible that if the test is done through a different lab company, it may be more affordable. So always let your healthcare team know about your costs. There are a variety of ways to receive financial assistance for other aspects of your medical care, like the cost of colonoscopies or medical supplies. A complete list of these resources can be found at the Foundation website. For colonoscopy cost assistance, you can contact your state health department for government-funded programs, or you can reach out to nonprofits like the Patient Advocate Foundation or Colonoscopy Assist. The colonoscopy coverage assistance that's available is typically for screening colonoscopy. In IBD, we often do colonoscopy to check disease activity or assess response to therapy, so this coverage may not apply, especially if biopsies are needed. It's important that you understand what your out-of-pocket costs will be for colonoscopy or other tests like flexible sigmoidoscopy or lab or stool testing. Discuss these costs with your healthcare provider. There may be an alternate plan that could be considered that's more affordable for you. Be aware that there could be facility costs, anesthesia fees, or provider fees that may be separate and not included with assistance programs. Insurance will usually pay for a certain quantity of ostomy supplies each month. Ostomy supply companies may have access programs that provide ostomy supplies to patients with financial need on a temporary basis free of charge. Ostomy organizations also provide financial support. The Crohn's and Colitis Foundation's database includes a list of organizations that may provide financial assistance for feeding supplies as well. IBD patients may have oral health issues due to a history of steroid use, vitamin deficiencies, or malnutrition. If your dental care is not affordable, the Dental Lifeline Network and the Department of Health and Human Resources have resources for free or low-cost dental care. Other types of financial assistance are also available. Pharmaceutical companies and the Patient Advocate Foundation offer college scholarships to IBD patients. Other scholarship opportunities may be available through other foundations. I often receive questions from patients regarding short or long-term disability. Most IBD patients do not require disability, and our goal with treatment is for our patients to have uninterrupted high quality of life. But a small number of patients are unable to work due to their disease. We'll go over the specifics of these programs in more detail. There are two programs available through Social Security. There's Social Security Disability Insurance and Supplemental Security Income. Having IBD does not automatically make you eligible for Social Security Disability Insurance. This is really only appropriate to consider if you have severe disease that makes you unable to work for more than 12 consecutive months. Many patients with IBD, even those with very severe disease, are in and out of remission over periods of time lasting less than 12 months. There are many challenges when applying for or receiving Social Security Disability Insurance. There's a high rate of rejection. 64% of all claims are rejected the first time. You can appeal, but it's important to recognize that you're not eligible for Social Security Disability Insurance solely because you have IBD. You may consider applying if you have severe disease that makes you unable to work for more than 12 months. Short-term disability insurance is a benefit that's often employer paid. The duration is typically 9 to 52 weeks. Short-term disability can be used if you're ill or injured and cannot perform your job's duties. The insurance will pay a percentage of your salary for a specified period of time. Long-term disability insurance covers a percentage of salary, often 50 to 60%, but this can vary depending on the policy. Those benefits continue until age 65, or your retirement age under Social Security, or until you're able to return to work. If you're able to work but have concerns about missing work due to unexpected flare-up of symptoms or due to the need to attend healthcare appointments or procedures, you should be aware that the Family and Medical Leave Act entitles eligible employees to take unpaid job-protected leave for up to 12 weeks in a 12-month period to manage a serious health condition. You can typically obtain this paperwork from your Human Resources Department and discuss your concerns further with your healthcare team. If you're unable to work but unsure about which disability option is right for you, it's important to talk with your IBD team about your disease and expectations for your disease activity. Your healthcare team should be able to share with you their expectations about your ability to return to work over the next year. The Foundation's IBD Help Center is available by phone Monday through Friday from 9 a.m. to 5 p.m. Eastern Time. You can also email them with your questions at info@crohnscolitisfoundation.org. There are a number of organizations that we discussed in this presentation that will be helpful to you. NeedyMeds.org and the Patient Advocate Foundation are two Crohn's and Colitis Foundation partners that provide information on patient assistance programs and guidance on insurance resources. Finally, and most importantly, always discuss your concerns with your healthcare team. They understand the cost of managing IBD. They can share knowledge on making smart, affordable choices. They can assist you in applying for cost-saving programs, and they can file an insurance appeal on your behalf if needed. Thank you so much for joining us today. For more information, please visit the Crohn's and Colitis Foundation website, crohnscolitisfoundation.org.